Doc Talk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan from DocTalk. Thanks for joining me today. We're going to talk about something that everybody has to deal with in the summer, and that's ticks. Whether it's on our dog or on our kids or on ourselves, stay tuned and enjoy the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to Doc Talk. Dr. Dan Thompson here. We're going to talk about ticks. And it's not something I'm an expert in, but it's something that I have a lot of experience in because I find a lot of them. But when we start to talk about ticks, if you've gone out and you've walked through the woods, or you've gone out to do chores, or you've had the cow dog out running in the pasture and you come in, or maybe it's your dog just running in your backyard, you come in, scritch the old puppy by the ear, lean down, and sure enough, we found a tick. Now, there are many different types of ticks, but the three that we're going to talk about today are the American dog tick, the brown dog tick, and we're going to talk about the deer tick, because these are the ones that are most common, and these are the ones that are causing the most problems as far as the health of our dogs and of human beings. But the first thing we need to understand about ticks is that they have a life cycle. So the tick life cycle is something that people don't normally understand. They think that, well, a tick just pops up and it grabs a hold of me and it gets big and drops off. But really, these ticks have a life cycle, and they are what we call a three-host life cycle. What that means is that the eggs from the tick are laid in the grass, and it takes about 30 to 35 days for those eggs to hatch. Once those eggs hatch, they go through different stages where they molt from larva to nymph to adult. And in between those stages, the tick has to attach to a host. So the tick eggs hatch into larvae. The larvae then quest, and questing means to hang upside down from a tree branch, and when the dog or you walk by, they drop off and grab a hold. Or they may be hanging upside down from a piece of grass, and as you brush across it, they will grab a hold. Ticks can move up to 20 meters, and they will use odor and different things to move towards you and find you, or find your pet. So, the life cycle. The eggs are hatched 30 days after they've been laid. We have larvae, which then quest to find the first host, which is generally a rodent or something to that nature. They will grab a hold of that host, they will engorge, and they will molt. And they will molt from the larva stage to the nymph stage, and they will drop off of that host and go back and quest again. When they grab that second host and engorge for 10 to 13 days, they are then molting from the nymph stage to the adult stage. They'll then drop off of that intermediate host and they'll look for the final host, which generally, if it's the American dog tick or the brown dog tick, it's looking for a dog. Okay, but these will also attach, these dermacenter will also attach to humans, and the deer tick will also find the final species, grab a hold of, and they engorge. Now, when the big females engorge on blood, they get full of eggs. They will then drop off, lay their eggs, and die. So the big brown ticks, the big round ones, are the ones that are full of eggs. They're going to drop off, and they're going to die. And so there's the lifestyle of the ticks. More to come after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Aaron Schaefer grew up on a dairy farm in Illinois. After attending Parkland College and the University of Illinois, he was accepted into the College of Veterinary Medicine at Kansas State University. Graduating in May 2015, Aaron and his wife, also a graduate of K-State's College of Veterinary Medicine, are starting a large animal ambulatory practice in Northeast Kansas.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here, and we were talking about ticks. And the main thing when we left talking about ticks, we were talking about the life cycle of the ticks and understanding that they go through molting from when they hatch from an egg and their larva to attaching to a host, drop off that host as a nymph, grab a hold of another host, molt again, drop off of that host as an adult, and then they look for their final host in which they're going to engorge. They'll drop off, lay eggs, and continue the life cycle of a three-host tick. And I think other people don't understand that it doesn't just grab a hold of one person or one animal and end its life. So there are three main types of ticks that we're talking about. We're talking about the American dog tick, the brown dog tick, and the deer tick. And all three of them have different characteristics and live in different habitats. The first thing is identification of them, and when you look at them, the smallest of the three species is going to be the deer tick, okay? The American dog tick is the one that we most commonly find in woods and on vacations, and the one that's a little bit larger. It's ornate, it has a flower pattern, and then the brown dog tick is a little bit of a not as patterned, more of a flatter view than what we see with the American dog tick. And then finally the smaller one, the deer tick, that is the one that is most famous for causing Lyme's disease in humans. So when we look at the difference in these three and see the pictures of the difference in these three, the other thing that differentiates these tick species is where they live. And when we're thinking about the American dog tick, or dermacenter, that tick is going to live in grassy areas, young forests, down around water areas, water gaps and things to that nature. One species of the American dog tick actually lives more in elevated areas and in Rocky Mountains. And that's the dermacenter tick that will cause the Rocky Mountain spotted fever. When we think about the rhipsocephalus or the brown dog tick, this one is not able to overwinter. It likes to live in kennels. It likes to live in areas of buildings, places where it'll lay its eggs. It doesn't necessarily have to lay its eggs in grass. It can lay its eggs on the premise and they can survive there. So the brown dog tick, we're going to be looking more around old buildings. We're going to be looking around places where they can overwinter, where they can get away from the cold, harsh temperatures, and might be more in proximity of your house or of your dog kennel or your barn. The deer tick is one that likes to live in deciduous forests or likes to live where there's areas of timber. So it's going to be looking for those maple and oak trees and living in more of the mature forest areas. So we've taken a look at what they look like. We've taken a look at the habitat in which they live in. When we come back, we'll talk a little bit about some of the diseases that they can cause.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
True Test Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, Dr. Dan here, and today we're talking about ticks. And it's something that we all have had visited routinely when we spend time in the outdoors, whether we're talking about ticks on ourselves, ticks on our dogs, ticks on our cattle, ticks on about anything. And you know, you always want to get the tick off and you want to make sure that you remove it properly. But there are some reasons why we don't want to have ticks get on us or get on our pets, and that's because they can be transmitters or vectors for different types of diseases, blood-borne pathogens. And when we talk about dermacenter or the American dog tick or the American wood tick, It can carry a bacteria that's a rickettsial agent that causes Rocky Mountain spotted fever, which is a pathogen that causes illness in humans. And so when we get bit by these ticks that carry the bacteria for Rocky Mountain spotted fever, we can wind up with a low-grade fever 2 to 10 days post tick bite, and it gets a low-grade fever, you get nausea, you get tired, and then about 2 to 4 days after you have that fever start, you'll come out in a rash. And it's one of those things that when treated early enough, it can be treated very effectively by antibiotics from your doctor. But if you start to see those signs in yourself after a tick bite, make sure you get to your doctor and have that checked out. When we talk about the common or the brown dog tick, and the brown dog tick, again, it is an inhabitant of buildings. It's the only tick that's an inhabitant of buildings. And this tick will be in the kennels, it'll be in our outbuildings, and it overwinters in those types because it can't face the harsh winters in the outdoors to survive. Now this tick is the one that carries what we call Ehrlichia canis. And Ehrlichia canis is one that causes a blood-borne disease in dogs, hence the name canis. And what it does is it starts to break down the white blood cells, it'll start to break down some of the platelets, giving that dog a low blood count or a low pack cell volume and have inability or a hard time of moving oxygen in the body with some of these different problems. So when we have problems with Ehrlichia, the dog will run a fever, it will be very lethargic, it won't want to get up, it won't be itself, but it's easily tested in your veterinary clinic. Make sure you work with your veterinarian, have this in your annual well check, get an Ehrlichia test on your dog, easily treated, easily prevented. The last species that we talked about was the common deer tick. And again, this is the smallest tick that's out there, and this one is going to be in the woods, and it's more of a east of the Mississippi issue in our big deciduous forests, but it's creeping west and we see it more and more. This is the tick that carries the Borrelia species of bacteria, or the species that causes Lyme's disease. And Lyme's disease is something that is commonly described as getting that bullseye type lesion where it's red and that from that tick bite. And if you start to see that bullseye type lesion, you start to feel achy, start to feel sick, fever, make sure you get to a doctor. But understanding that these 3 ticks that we talked about today, 3 different species, 3 different environments, different types of diseases. More on ticks in the wrap-up after these messages.
The BQA Tip of the Day, sponsored by Boehringer Ingelheim Vetmedica, Inc.
Hello folks, Dr. Nels Lindberg here from Great Bend, Kansas with Production Animal Consultation and Animal Medical Center. Today's BQA Tip of the Day, we're going to talk about pen surface management. And pen surface management doesn't just have to do with feed yards, it has to do with cow-calf producers that have any sort of pens, stockers, starter yards, and feed yards. We all need to do a great job of taking care of our pen surfaces. We can often forget about them. We have many other things to take care of, but again, we want to maintain an excellent pen surface for these cattle. It's good for their welfare, it's excellent for animal health, and if we don't take care of them, can also negatively impact animal performance. We must groom these pens periodically. Pen populations, how often cattle are in them, will often dictate that. Bedding cattle will dictate that. If we're feeding them big round bales and pens, will dictate that. But again, we want to have a clean, dry pen surface for these cattle. Whether it's a cow-calf herd and baby calves, feeder cattle, stalker cattle, whatever it may be. If we have a lot of buildup, whether it's manure or feed particle or bales, bacteria, viruses sit in there and they continue to cohabitate and infect new cattle or the same cattle or baby calves, creating unhealthy situations for all the animals. Let's do the right thing, take care of these pen surfaces, groom them frequently, and make them look like this pen right here. Thank you much.
it must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously, but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here from the Veterinary College at Kansas State University, and you're watching Doc Talk. And you know, we really enjoy y'all watching the show and spending time with us. It's you have a lot of options on things that you can watch, and we're glad that you choose to spend some time with us. And the other thing I really enjoy is when I'm out and about in the country and out and about doing meetings across the United States or around the globe, somebody will come up and say, hey, I saw you on Doc Talk. And don't ever hesitate to come up and say hello and introduce yourself. I love to meet the people that are watching it. Thanks a million for watching the show. But let's get back to ticks. One of the things about ticks that we've discussed, and as we left, you know, Lyme disease is not just something that humans can get. Dogs can also get Lyme's disease. So if your dog is, anytime that your dog is exhibiting what we call ADR, ain't doing right, okay? Whenever your dog is lethargic, or if they start to decrease their eating, or they have a change in their feeding patterns, those are times when you want to start to work with your veterinarian and start to make sure that, and tell your veterinarian about the clinical signs, or if you've picked ticks off your dog, or if you've just been camping, or the dog has been in an environment, something to visit with. And whenever you're talking about Lyme's disease or Ehrlichia canis in your pet, the one thing you want to make sure is that you're working with your veterinarian on a couple of different areas. One is you want to make sure you go in for that animal's well check, okay? And so when you're going in there for your vaccinations and things to that nature, you want to talk to your veterinarian about ticks. You want to talk to your veterinarian about ehrlichiosis and about things to that nature. If you're in an area where there's a lot of brown ticks, or if you're in an area where there's a lot of deer ticks, you may talk to your veterinarian about the opportunity to have testing done to make sure that your dog has not been affected or is not currently affected and having subacute clinical disease that's caused by these ticks that we see in these problems. If you have an acute problem, of course, get your dog in and get it looked at right away. Now, the next thing that you want to talk to your veterinarian about is working up a plan to prevent ticks in two different ways. And the first one is decreasing the habitat in which your dog is exposed to. Now, if you have a house dog and you're looking at decreasing it in your yard, you want to make sure that you're mowing the grass, that you're pruning trees, increase sunlight into your yard. All of those types of things can help decrease tick populations out and around your house. There are many different products out there that are available, whether it's through collars or through pour-ons, that working with your local veterinarian will help you find the proper tick control, understand the tick species, understand, you know, we can't keep all the ticks from getting on your dog or cat. We can't keep those types of things from happening, but maybe we can reduce the number of ticks that get on our dog, cats, kids, and ourselves. Thanks for watching Doc Talk. Thanks for joining me today. I hope you enjoyed our discussion on ticks. It's been enjoyable to me. Remember, always work with your local veterinarian. If you want to know more about what I do here at DocTalk, you can find me on the web at www.vet.ksu.edu. Thanks for joining us today. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.